I think when we talk about telehealth, this is of sort of broader definition. So this includes your counselors, this includes your mentors. Okay, when you talk about telemedicine, okay, our activity at the beginning, it can include your different specialties like your dermatology, your teleradiology, your tele-ICU, tele-stroke. Okay, so these are some of the specialization in primary care that is included in the telemedicine. Okay, I won't deal so much with the definition of terms. I'm sure for most of you who are doctors and medical students, you can easily find out the definition of that on online. But I think what I just want to emphasize here is that the components of teleconsulta or telehealth or telemedicine is that there is a digital communication technology. Sometimes you get so stressed the term digital technology because I myself must confess sometimes I spend a lot of time troubleshooting with my mobile phone or with my gadgets, and one of my pet peeves is actually wasting a lot of time troubleshooting because you really don't know how much you will spend or wasting time on one issue or one IT issue. Could be a minute, suddenly 20 minutes is gone. So I think this can bring about also stress for those doctors who are using this platform. But the important part again of or component of telemedicine or telehealth or teleconsulta is that you have a digital communication technology. It could be your smartphone, it could be your laptop or your desktop, and another important component of your telemedicine, it is done remotely. Okay, so you are probably in your home office, or you could be in your clinic, but your patient is somewhere else. They could be at home, or they could also be in their office. Okay, but of course, in the time of the pandemic, if we are working from home, most both doctors and patients are at home doing the teleconsult. Okay, so there's a digital method for patient. Here, I just included or highlighted expatriates, as I mentioned in my beginning slide. Okay, when we craft laws or policy, okay, it is an appeal to those who are lawmakers or lobbyists to always include the expatriate because they're important part of the society. Okay, about 10 million overseas are based outside the Philippines. So this is also an avenue for a lot of doctors and healthcare workers not to forget because they also need teleconsulta. Okay, I've highlighted here not urgent. I think this is one of the major decision of a doctor doing teleconsulta to decide because for not if it's not emergency, whether acute or chronic, okay, if it can be managed through a teleconsulta, then you have to proceed. But any signs, okay, coming from the patient, okay, based on the history taking that it cannot be managed through a teleconsulta, then you have to give the proper advice to your patient. Okay, so and telemedicine again is being highlighted because of the lockdown. Okay, if you're in many parts of the world, they say lockdown or quarantine. In Singapore, we call it circuit breaker. Okay, so every type of quarantine will have different restrictions depending on the government policy. Okay, so this is basically your teleconsulta or telehealth or telemedicine. Okay, so who I think for the crowd, I don't know everyone in the crowd, but I was given the assumption that mostly are doctors, some are medical students. Those who are in med school or finishing, and then they want to practice tele health. Um, I think talking about specifically about teleconsulta, the important thing is that you are a licensed doctor. Okay, you have your PRC license if we're talking about the Philippines. If we're talking about the US, okay, you have to be licensed for that country. At the same time, you have to check the state requirement because there are many requirements or there are not many, but there are specific requirement where you decide where you are located, and that would be the laws or the policy that you have to follow. This becomes a bit more complicated if the doctor, for example, a doctor from New York, decided uh, to travel and be based somewhere in Colombia. Okay, where will which laws will he follows? And this is definitely happening because many of the not many, but there are some doctors who are practicing outside of their own state, but they're still able to do to conduct their own teleconsulta platform. Okay, so something to think about for now. For telehealth, again, this is a broader sense. You have to be a licensed or a competent counselor. Uh, if you're a nurse, then you have to be a competent or licensed nurse. If you're doing telepsychology, then you should be a competent and or licensed uh, psychologist. Again, as I mentioned, I cannot individualize every laws that pertains to the practice of individual profession. This is just the general guideline, but again, for teleconsulta, okay, for doctors who are here, you have to be a licensed doctor, and it has to be you have to be an active uh, uh, doctor. Okay, it shouldn't be expired your license. Okay, at the beginning, I mentioned about the laws, the policies that are involved in teleconsulta. Again, this is a discussion of its own, a webinar of its own, but I've just listed here some of the policies and laws that are supporting the practice of telemedicine within the practice of medicine. Okay, so Medical Act of 1959, I think there are many calls to update it. Many, several batches of our Congress, the 16th Congress, the 15th Congress, tried to update this, but up to now, this is the act or the policy that influence our practice of medicine. I think I'll just focus on the guidelines in the use of telemedicine, which was released by DOH and NPC. This is your National Privacy Commission. They released a joint memorandum regarding this. If I'm not mistaken, this is a 6-page memorandum circular. Okay, again, I won't discuss the 6 pages of memorandum circular. Under my sources and under my reference, you can click those link and you can read it on your own. But basically, this gives sort of guidelines for doctors who want to establish their own platform in terms of teleconsulta. There is a pending bill in the houses of Congress, either in the House of Representatives or in the Senate, about e-health and Telehealth Act of 2014. This is a sort of a previous version of an earlier bill, but was also not passed. This laws that I put it here, this is not the only policy or law that includes or touch on the issue of telehealth or telemedicine. There are more, but I think these are the probably the 4 that are the most connected to our discussion for this morning. Okay, so when I was again doing my research, I came across with an original article establishing a legal framework of telehealth in the Philippines. And this was published in the Acta Medica Filipina. And this was written by Ivy Padtu and Alan Tenorio. I'll put a reference again, or you can Google this original article. It's quite interesting, especially for those who are really contemplating on how, on setting up your own teleconsulta practice. Okay. Okay, another sort of announcement that was given by the Department of Health. Again, I'm mainly focusing in the Philippines right now. Okay, they came out with sort of an information because of the COVID outbreak, and they partner with Tele-Konsulta platform. You can read it from there. Again, this is by no means an endorsement of this platform. What I can share is that uh, other organizations, particularly, for example, I come from AMDA, and during the early days of the pandemic, okay, Dr. El Ray, they initiated a free free medical consult online, and I think those are commendable efforts from different organizations. These activities, I think, generally is helping a lot of patients who are stressed and they are not able to access health care. Um, as I proceed with this discussion, I'll show you a more platform of this Tele-Konsulta. Okay, so this is an information that is in the DOH web page. There's a lot of information there. You see telemedicine here. It's not only specific to your video conference. It could be just your normal telephone or your mobile phone. You could do telemedicine using your WhatsApp, your Viber. Okay, of course, again, every country would have a different policy regarding which digital communication platform that you are use. Are they encrypted? Are they secure enough? And this is something that if you decide to set up your own platform, you have to decide which one platform is secured, which do you think is the best in terms of interface when you're talking to your patient. So I'm just letting you know that telemedicine doesn't have to be just video conferencing. It can be other forms of digital communication. Okay, so I did some review of all the different platform. Some they use their own homepage. Some decide to partner with already established medical teleconsult platform. There are, I think, two that are very popular. Okay, and I've shown you an example here as well. Okay, so there are many more. Again, this is by no means the only platform available. Okay, so here you could see that even Makati Medical Center, they have a 4-step of how to do patient telemedicine guidelines. You download Zoom. Okay, Zoom is, I think, very popular now, although they do have some issue with some security and privacy. You do register, and then you schedule an appointment, and then you pay through a payment platform here. I think they use Pay Maya. Okay, so my suggestion here is that for patients who are booking, you book at least 2 to 3 days in advance, because normally the secretary will contact you for informed consent, issues about limitations of teleconsulta, and things like that. So it's something that you plan ahead as well. Of course, you can go to the platform of those doctors and they might not be available on the specific time. So how do you book them? Okay, so you can see some of them would even promote or not, probably the term that I want to use is that put their information in Facebook, but I would think, okay, they would bring this discussion on a more secured platform. Okay, this is only the way for you to get in touch to them. They show their teleconsult schedule on Facebook, but my assessment is that they bring you to another or to a more secure platform that are compliant, okay, with the regulating authorities.